Welcome, everyone. Thank you so much for joining us to this launch of Planetary Health webinar series. My name is Harriet Naiga. I'm a midwife, and I'm the founding director of Midwife-led Community Transformation, MILCOT, from Uganda. Before we proceed, let's have a recording from our program director, Gemma Stacy. Unfortunately, she's not been able to be with us, but she recorded a message for us. Let's hear from her.
Hi there, welcome to the launch of the Nursing Now Challenge Planetary Health webinar series, Nurses and Midwives for Planetary Health, Global Voices on Climate and Care. I'm Professor Gemma Stacey and I'm the Programme Director of the Nursing Now Challenge, and I'm so delighted to welcome you to today's session. We're coming together around a key global agenda, and nurses and midwives have a crucial part to play. I really want to extend my sincerest thanks to the partners that have enabled us to pull together such an exciting, inspirational and informative programme. We are joined by the Centre for Sustainable Healthcare, the Alliance for Nurses for a Healthy Environment and MILCOT, whose expertise, collaboration and commitment to planetary health have made this webinar series possible. Because you've joined us today, I'm sure you'll agree that planetary health is not a future issue. It's present in our reality. It's shaping the health of our communities that we serve every day. It's important that we start to understand the role that nurses and midwives play in both mitigating the impact of climate change, but also adapting to the implications that are already present within our communities and populations. As nurses and midwives, we are really uniquely positioned at that intersection between people, communities and the system, which means we really do have an opportunity and a responsibility to lead in this space. So this series is really designed to inform and inspire you, but also to equip you with some really practical knowledge and global perspectives. And over the course of the coming months, we will be hearing from expert voices and also emerging leaders and innovators who are already driving change and making real difference in the area of sustainable healthcare. So we really hope these webinars will spark conversation, that it will bring opportunity for collaboration, but most importantly, action. And that action could be locally, nationally, but also globally. As you all know, the Nursing Now Challenge is fully committed to developing courageous, informed leaders who can influence policy and practice and systems for a healthier planet and ultimately a better health coverage for our populations. Thank you as always for being part of this community. Your leadership in this area really does matter, and together we can start to help to shape a healthier and more sustainable future. I really hope you enjoy today's welcome webinar session and the start of the Planetary Health series, and I'm really looking forward to where this conversation takes us and develops for our community.
What a great message from the program director, Professor Gemma Stacy. Yes, indeed, the reason we are here is planetary health and our involvement as nurses and midwives in tackling climate change impact on the population. As I introduced myself to you, I'm Harriet Naiga, and I work with adolescents, marginalized adolescents and young adults. And I have experienced, I have found out that as nurses and midwives, we are directly in touch with the people who have been affected by climate change. I come from a country where climate change has really impacted on the lives of the population, especially in our capital, Kampala. And that is where I have drawn my inspiration to engage nurses and midwives in planetary health so that we can bring our voices so that we can lead in planetary health. And here is the reason why. For example, when it rains in Kampala, we have a problem of floods. And one of the reasons why we have floods is because plastics tend to block the drainage channels. And when it rains heavily, we see flooding everywhere. Lives have been lost, people have been displaced, and people have suffered waterborne diseases, especially malaria and diarrheal diseases. In my capacity as a midwife, as I work at Millcourt General Clinic, an initiative that was established between Millcourt and Vaca Health Foundation to increase access to maternal and child health care services among marginalized communities, we receive a number of women with children coming to seek services. And as I have supported them, as I have treated them, I have realized that my care really influences how planetary health is shaped. And since I am directly in contact with them, I have seen myself as a source of information to them. How do they contribute to climate change? And what can be their role in mitigating the challenges that we have? As such, I have gone ahead to establish an initiative of paper bag, where we do produce paper bag, and I train the marginalized adolescents and young adults. I have trained my team at the clinic so that ourselves produce paper bags in place of plastic bags that are being widely used, especially the single-use plastics. So we have gone ahead to educate the community, and this has been very, very impactful. It's not only in my community. We have seen many countries going through almost the same challenges. Today, as we speak, in Germany, it's really sad that police has had to deploy water cannon to just spray water over people to provide a cool environment because of extreme heat. It's not only in Germany, it's in many countries. We have seen riverbanks getting broken because of human activities, and we have seen lives being lost. We have seen water bodies dry. And as I speak now at Millcourt General Clinic, we have suffered lack of water because during during the hot season, water tends to be scarce because water levels tend to go low. So as we are moving ahead in this planetary health series, webinar series, I would like us to take few minutes and pause, 2 seconds and pause, and think about the challenges that we have seen in our communities, the challenges we have heard about, the challenges that the population is facing because of climate change. Unfortunately, climate change impacts are not only affecting few people, but all of us are being affected right now. And we are wondering where we shall be in a few years to come. And this is the call why, in partnership with Nursing Now Challenge, Center for Sustainable Healthcare, and Alliance of Nurses for Health Environments, have come up to raise the voices of nurses and midwives. And let's speak together. What can we do? What you are doing in planetary health needs to be seen to inspire others. It needs to influence others. And if we stand together and work towards having a difference, towards advocacy, so that nurses and midwives can be supported in leadership in planetary health, there will be a huge difference. That is the reason why we are here. That is the inspiration of this webinar series. And as I finish, I want to invite some of our speakers who are going to give us their insights because they are directly involved in climate action. We have a lineup of speakers, including a great panel of global leaders from our partner organizations. Let me start with Miss Obianuju Madike. She's a registered nurse and a health tech product and operations. Let's hear from her.
Hello, that's fine. It's Obianuju, and I'm happy to be here. I have also been a managing director for climate tech startups in Nigeria, and that's where I bring my wealth of experience with understanding the climate challenges also in Nigeria and how it's affecting us across board because I'm currently registered in the UK right now. And being able to see the impact of climate change across board and the importance of collecting accurate data while managing our patients. I'm really excited about the conversations that we are going to be speaking about today, and also wanted to say that product and operations manager. So, but it's very fine. I'm so glad to be here and honored. So I'll be moving the mic to the next person.
All right. Thank you very much, Ms. Madike, for that information. Okay, we are going to have Dr. Ebenezer Akore. He is a lecturer, nursing climate change, sustainability healthcare research, and he's from Birmingham Newman University. You're welcome, Dr. Ebenezer.
Hi, thank you all. Harriet, is this the part I talk for my 10 minutes or this is just introduction? Hello, Harriet.
Yes, please.
Do I just introduce myself or I talk for my 10 minutes?
You can go ahead and talk for your 10 minutes.
Okay, all right. Thank you very much. And my colleagues have started the work for us and it's easier for some of us to chip in quicker. Thank you, Harriet, and all the team, all the sponsors for this particular program. My name is Ebenezer Akore Yeboah. I'm originally from Ghana. That is where I had my training. I had my training in Ghana, Kwame Nkrumah University of Science and Technology. And with that, I moved to the UK after some years of experience, then became a registered nurse in the UK. After a few days in the UK, or let me say about 120 days in the UK, I got a PhD scholarship to do my PhD in nursing, climate change and sustainability. And at the moment, I am a lecturer at Newman University. So since I've been given the opportunity to share with you a little bit of information, I would like to share a slide that I prepared for the journey and also to inspire all of us, the journey I've gone through. So with climate change and the support I also had from organizations such as the Nursing Now Challenge and also from Florence Nightingale Foundation. So this is a little bit of slides to share my journey. So I've talked of my bachelor's in nursing. I was later trained as a WHO malaria vaccine safety site trainee, and I also became a research study nurse for a global vaccine trial some years back. I am registered both in Ghana as a nurse, in the UK, and in the United States as well. During the journey, I became a sustainability subject expert at Florence Nightingale Foundation. A thumbs up to Lucy Brown. At that time, she also introduced me and gave me the platform to grow. And I became the nominated rep on UK Health Alliance on climate change. So I have a PhD in nursing and climate change. I'm a lecturer at the moment. I'm also an elected member for West Midlands Board, Royal College of Nursing for their Professional Nursing Committee, and also I serve on the International Advisory and Scientific Panel. To continue a bit with my research, looking at the impact I saw back home, for example, malaria being one of the impact we see from climate issues, looking at how people are suffering from some of these climatic events and co, and looking at the footprint that the healthcare sector do have, we have all read and have come across that it is so massive that if the healthcare sector were a country, would have been among the first 5 largest countries emitting emissions, carbon emissions. So I wanted to then research to see how much of a role could nurses play, the scalable impact they could make in relation to climate change. So I had a phase 1, which was a systematic literature review, move into a phase 2, which was a multi-country survey among nurses. I will talk a little bit about all these things and then move to a phase 2, which was a qualitative interview among UK healthcare and clinicians. For the systematic literature review, at the end of the day, some of the issues I was finding or noticed was that the papers were reporting that nurses were aware of climate impact. They were also aware of people that they provide care to when they suffer climate change. But when it comes to their practice and the release of carbon emissions, there were limited knowledge in that side. There were limited perception. So it gave me that room to explore. I did research about that, and these were some of the findings which have been published in the literature at the moment. From the findings I got, and being the first among few doing some of these research, we decided to also conduct a global survey, which I had over 500 nurses from 56 different countries. I want to say a very big thank you to the Nursing Now Challenge, because at that moment we had to go to them to guide us and to also host the survey on their website. As it stands now, if you go to their website, it's still there with a bit of information about me. And that is how we're able to reach loads of people. And also, I want to acknowledge massively with Florence Nightingale Foundation, which also shared my survey with a lot of participant nurses across the globe. And I was able to get these representation, as you see on our slides at the moment. We had about participants from 140 plus from 15 African countries. So there were a lot of participation from the African continent as well, which was the second highest. The paper I'm talking about, the global survey, has been published at the moment. It is in print. Anybody could read about it and show how much of a nurses are doing. About 80+% are aware of this, and they see the link between their nursing practice and climate change, and we could use that. Just that awareness of policy were a bit limited. As a result of that, they were pointing fingers to limited leadership and also organizational support. So I had to do a qualitative interview, and currently that paper on the qualitative is also under review. I've been able to develop an educational course content. So to help nurses to grow in leadership, in knowledge, I am also integrating some of these courses on climate change and sustainability into my teachings in the university as we speak at the moment. And also, I have developed a sustainable healthcare transformation framework, a framework which will guide people into leadership, into implementing. So on the right of the slide, you could see the framework, how it looks like. It is yet to be pilot tested and come into publications soon so that people could also use it to guide others. Now, to come to the other bit, due to this research that I have undertaken, or let me say the research I've undertaken has been disseminated across the globe. I have presented it in over 17 conferences. And when you go there and you start to talk about nursing and climate change, people are like, how is this related to yours? Is about the care you provide to patients. But they forgot that long-standing, we have been part of this public health element. We've been part of these social justices. We've been doing this as part of our duties, but we are now throwing more light into it and showing leadership. So I've presented that in Spain just last month. I've been to the United States to present it, to Finland on an International Council of Nurses Congress as well, been to the UK in Wales. And beautiful part of it is that the work we are doing also in climate change, as you are all here, is also having impact. the survey tool that I developed was adopted by midwifery academics in Australia that they are undergoing a project currently among midwives globally. And some of the things that I've been doing is that I have contributed to a book chapter on planetary health in Canada. It will be out very soon by the end of the year. And also I'm contributing to other chapters of book on AI and healthcare, and also with the European Nursing Specialist Organization, to just encourage all of us and to show that we can do much. Our works could also influence policy. In few years, I was awarded the Early Career Researcher of the Year, and BBC recorded that. I was also invited to speak on making the NHS green. So nurses having a policy influence, nurses having a bit of a voice in leadership and in shaping societal thinking, this is what we want to encourage all of us to get into that field. Now, to also see that I also presented my work at the RCN Congress in Wales, and that is the fourth picture. That a video of that particular speech that I gave has got more than 23,000 impressions on LinkedIn as we speak now, telling people of how much of a role that we have in climate change and sustainability as nurses. Now, to conclude, I would say that I am also proud that during the parliamentary discussions in the UK, my work and my name was mentioned about how much nurses could do when it comes to these single-use plastics and climate change and others. This tells you that we have a role to play. Our impact knows no bound. It can go beyond all other aspects of this society we find ourselves to develop ourselves as well. So to encourage more, there are other researches that I am doing to implement some of these things into it. So I want to say a big thank you. We have a planet to protect. Let us all do our best, and part of it, we have people to help. Sustainability goes beyond just the environment. It looks financial, it looks social as well. And there are a lot of resources on that triple bottom practices of some of these things when you check the Center for Sustainable Healthcare website, and they have trainings that you could also have access to. So I would end here, and maybe along the process, there will be questions that will come that I will talk about. So I want to say thank you. And also in my local language in Ghana, we say thank you as Medase. So yes, this is where I end my work. Yes.
Wow, wow, wow. Thank you very much, Dr. Beneza. I think this is really something that we've been looking for, because the research that you have just shared with us is going to be very, very useful to many nurses and midwives who are aspiring to do research in climate change. And we really love the way you have elaborated and you have stressed much on sustainability, because however much we do programs, if they are not sustainable, then we shall not have them in a long term. But thank you so much. I really want to encourage all the participants that would love to ask the speakers. Please take note of your questions. You're going to be given time towards the end, and you give your questions and they will be answered. Or please feel free to just type them directly in the chat. They will be noted and they will be answered. Thank you very much, Dr. Ebenezer. And I want to go back to Dr. Madike. I'm sure now the technical issues have settled, and she's going to come back and share with us what she has for us.
Thank you
You're
so
welcome,
much.
Dr. Madike.
Thank you. I'm not yet a doctor, but thank you so much. So I don't want to take the PhD title without working for it. But thank you so much, Dr. Ebenezer. Your session was really inspiring. So as well, I would like to start off with my journey as well. I'm a registered nurse from Nigeria and recently qualified in the UK. And along my journey in Nigeria, because I did work in Nigeria after graduating, and during that time, I discovered technology. And my first role was working with a product, as a product manager with a climate tech startup. And that's when I really got into the world of understanding climate technology. The first company I worked with was a startup that specialized in carbon calculation. And that is really understanding the carbon emissions that we generate throughout our day, and they were offering this service to businesses. And it's from little things such as the electricity that we burn in the hospital, the air conditions that we have on, and understanding the impact of these equipments throughout in the planet, the trees and the water that we drink, and all of this, really understanding that and really understanding the impact on our health. So that's what this company was doing. But the thing is that I never really sat down to understand that these little devices that we turned on, leaving the switch on, could really impact, our overall climate, right? So it was really amazing to work with that company. But I didn't just stop there, because I did go on to work with another climate tech startup. And this company, we are taking it to the next level, which was helping these companies that had high carbon emissions offset their carbon emissions through connecting them with sustainable businesses like yours, Harriet, that we are creating, using paper for their packaging instead of plastics, that we are clogging different water sources and causing flood. And that really led me to understand that it's really the little things that we do in our climate that really is really the little changes that we make that affects our overall health. Because you could see that people that are in environments where there were plants and where there was reduced carbon footprints, because most people were embracing this embracing cycling, that they generally had like a reduced there was reduced respiratory tract diseases, reduced airborne water diseases, because their climate was replenishing them and not really taking away from their overall health. But that's really my journey from being a registered nurse and now entering the climate tech startup. I'm really intrigued by technology and how it makes our workflow better. And I've had the opportunity to see both sides of the coin, which is when you're using paper for your documentation and for everything, and when you're using electronic devices for your workflow and really everything in the hospital. And I really wanted to highlight on that, because it might look like it's such a small thing in our daily workflows, but it can really affect the overall health of our patients if we reduce this carbon footprints, right? Now, because I have some notes down. Now, in our workflows as nurses, in some places you might currently be using paper, you might currently be using electronic, but you as nurses, we do have a big role to play in helping these companies transition, especially when they want to transition, because I've led a hospital switch from paper to digital, and I saw how important it was for nurses to understand their current workflows, not just in our own unit, but working across different teams, because we are very integral to the work in the hospital. You work across labs, doctors, even working with the porters and the nursing associates. And really understanding your workflow helps with incorporating technology into your workflow, because when you incorporate technology, there will be less paper that will be used in checking for the vitals and writing notes, because you can use the laptops to reduce the amount of folders. If you've ever seen where folders are being thrown away when they're being burnt in the hospital, is really counterintuitive to the health that we're bringing to our patients. Burning paper in a hospital that is supposed to bring life and health to people that we're taking care of. We're burning paper where there are patients with respiratory diseases in the ward, patients that need our help, and we are burning paper because there isn't space to house the excess paper that are being used to record vital information about our patients. And what I want to just really speak on, because I've been in the forefront of helping nurses, and I really want us to really facilitate that awareness of technology, doing our little bits to understand how certain things work, how to if all of us are here on this call, then definitely, not really the prime audience, but you can share the word, how to use your email, how to set up a meeting, how to, use your notes and the system to actually record your patient's vitals and important information. So I really wanted to share some resources because I'm all about using technology in healthcare because this overall reduces the carbon footprint that we use. And I wanted to speak about understanding share some resources that we could really use. So first off, I would like to say there is a beautiful course that is being shared by the Nursing Now. If you actually go to the Nursing Now resources, you can see the design thinking in healthcare is being offered by Penn University. It's for free. It's on the Nursing Now Challenge resources. You can have a look there to see how to really understand not just the way to help your hospital leaders incorporate electronic records, medical records into your hospital, but also how to offer solutions to problems in the hospital. We've heard amazing solutions from Dr. Ebenezer and Harriet as well about incorporating both physical products such as the plastic bags and digital solutions, offering frameworks that can be used all over the world. And now you can also be part of that transformation in your own little corner. And taking the course, which is a very insightful course, I must say, which is the design thinking in health. It's on the resource again, and it can really help you think about the different problems that you're facing in your sector, but most importantly, how to offer solutions that would change the trajectory of how we work moving forward. When I got into an organization that was switching from paper to electronic medical resources, I was actually in my first year after my studies. So I was very fresh and still I was able to lead this change, able to teach senior nurses how to understand the system, how to make use of this. So you're never too young to incorporate change in your own little corner. It's never too late as well. Another resource I would like to share is understanding data science in AI. It's offered by Data Camp, which is an amazing resource if you're really trying to understand what AI is, because there are a lot of innovative solutions coming into healthcare using scribes to take notes when you're speaking with patients for history taken. But you as a nurse, you can also incorporate these solutions. You can also be part of this change. And that's why I refer to that's why I refer to this resource, which is understanding data science and AI, and also really understanding your workflows. So I know that a lot of the work that we do as nurses can feel a bit repetitive because it's like you're doing the same thing over and over again. But that is actually a strong superpower, I would say, that we take for granted, because understanding what you do daily, you can actually incorporate with the 1% better rule. You can actually be innovative about the way that you do things, which is, yes, we do check vitals every day, but some patients, they don't know what these vitals even mean. What can we create a small infographic on the walls that helps them to understand that when we are not there? You can use that as a strong suit, and then it's easy to bring weigh in or buy-ins from leads when you bring up solutions such as switching from paper-based history taking to electronic, because they have seen the changes that you have made while working in the units, and now being able to incorporate bigger changes that you are also bringing to the organization. I'm really excited. Yes, thank
That
you.
is really, really great. Thank you for sharing. Let's
Yes,
try to
thank you.
summarize.
Yes, I was summarizing. Thank you so much
All right.
once more for this call. And yes. Over
All
to you.
right. Thank you so much. Thank you so much, Madike. That was super amazing. I think you are very, very resourceful. And one thing that we have loved from your resources is that they are readily available, and you have already shared with Nursing Now Challenge. Digital health is such a significant component that right now we can't move without. And I strongly believe that nurses and midwives interested in climate change, I think we can utilize all these resources that she's talking about. So thank you very much. And I hope that questions are being noted and kept later so that we can ask our speakers. All right. And that takes us to the panel of leaders. Our partners, and these are really directly working in climate change. They are empowering nurses and midwives. They have resources, and we are going to hear from them. We are going to start with Cara Cook she's the she's the Deputy Director of Alliance of Nurses for Health and Environment. Thank you very much for joining us, and we are looking forward to hearing from you.
Yeah, absolutely. And I'll just give an introduction to myself because I think then we'll go into the questions after all introductions. So I am, again, as Harriet said, I'm Kara Cook. I am based in Baltimore, Maryland in the United States. I work for a nursing organization called the Alliance of Nurses for Healthy Environments. And just to give a really quick overview of our organization, we are an international nursing organization focused specifically on the intersection of health and the environment. And so we work with nurses across 4 key areas. So nursing research, nursing practice, nursing policy advocacy, and nursing education. And so working to engage nurses, engage nursing organizations, and to advance planetary health, climate concepts across the nursing profession. And I'm so glad to be here on this amazing panel and this amazing discussion.
All right, thank you so much for that introduction. I think I can just go ahead to Milagros Rosado. She's the Program Manager for Climate and Clean Energy Advocacy at Alliance of Nurses for Health Environment. Let's hear from her.
Thank you so much, Harriet. It's a great pleasure to be here. Yes, my name is Milagros Rosado Elia. I am the Program Manager of Climate and Clean Energy at the Alliance of Nurses for Healthy Environments. Prior to this, I was an oncology nurse practitioner for 28 years and transitioned over the last 2.5 years to directly working in the space of environmental health, in particular climate change. It is extremely meaningful to me to be able to speak to colleagues globally and to hear and receive what is happening and be able to share my journey through nursing. So it's my great pleasure to be here with you all today. Thank you.
All right, thank you very much. And we shall hear more from you, and we shall have some questions for you to help our participants. Before we hear again from them, let's have Lucy Brown she's the Development Director at Center for Sustainable Healthcare. You're welcome, Lucy.
Oh, thank you so much for having me. It's an absolute pleasure to be with you all today with like-minded individuals who really want to lead change. As Harriet said, I'm Lucy Brown. I'm the Development Director at the Centre for Sustainable Healthcare and a very proud nurse. To follow Milagros, I'm a paediatric intensive care nurse by background, but more recently been a Director of Nursing. And I guess it's probably important for all of you to know, I like the comment from Mercy in the chat which says you can be anything you want to be as a nurse. I totally agree. And I did a big career pivot, very similarly to my colleagues here on the call, about 5 years ago when I learned about the plight of the planet and thought, well, actually, what can I do within my influence and my control to really lead this change? And that's how I ended up in sustainability and planetary health. So I'd urge you all to join us on that journey too. The first step is joining us on this call. A little bit of a background about the Centre for Sustainable Healthcare. We're a not-for-profit, non-government organisation based in the UK, but providing resources for healthcare professionals across the globe. We've been around for almost 20 years working in this space, so got a lot of resources to share. I'll put some in the chat for you to have a look at. And we have lots of nurse-specific programmes as well, and have over 34 different specialty networks for every area of clinical practice. So everything from critical care to surgery to endoscopy. So every nurse that's hopefully on this call, a midwife, will have something they can access. And our mission really is to turn knowledge into practice, into action. We've got so many case studies you can use and shift and use within your practice. We've done the hard work for you. And I think Ebenezer was talking about the triple bottom line. We measure all of that in our projects as well. So looking at the economic impact, the environmental impact, and the social impact as well. That's enough from me. I'm looking forward to the questions coming up. Back to you, Harriet. Oh, you're on mute, unfortunately.
Oh, sorry, I was muted. Now I'm here. Yes, thank you so much, Brown. And that was really amazing. We love how you empower nurses and midwives directly and how you turn knowledge into practice. So one of the questions that I would love to ask is that how can we better prepare students and early career nurses to become leaders in climate action and sustainable healthcare? I mean, rather than seeing these issues as optional or separate from clinical practice.
Would you like me to? I don't mind answering that one, if that's okay, fellow panel members. Yes, I'm not okay. I'll go for it. So I think all of us have a responsibility, and I think as nurses and midwives, it doesn't matter what level you are, you're leaders. You're leading your patients, you're advocating for your patients. So I think you don't need to have a title to be a leader, particularly in our profession. And what we need to realise is our power as nurses and midwives, as early career nurses and midwives, for all of you on the call, is that you are influencing patients and their families to make the right decisions about their healthcare. You are the most trusted profession on the planet. How about that? So actually you can influence populations to make the right decisions that will impact on their health, but also the health of the planet too. So that's probably the first place to start, is understanding your role, your power and your influence. And I guess the next stage to that is thinking about how you can educate yourself and those around you. So I know Annie, I've got wonderful resources we have as well at the Centre for Sustainable Healthcare. So use the resources you've got, educate yourselves, and then share that knowledge far and wide with your colleagues and with your patients as well, because that's the first step, is actually sharing that. And we have an obligation, don't we, as nurses and midwives, to share that to empower others. So that's kind of my first step and first insights.
All right. Thank you very much for that response. I hope it has been very helpful to the participants. Okay, now I'll go back to Rosado, the program manager for climate and clean energy at Alliance of Nurses for Health. And let me start with a question before she goes ahead. Perhaps it will help to guide us on what we need. Hi, Rosado. For example, there is no single profession that can address the health impacts of climate change alone. So what partnerships or allies have been most valuable in your work, and how can nurses and midwives position themselves as agents of change in climate and sustainability efforts?
Thank you, Harriet. That's a phenomenal question. It's a very global question. I think nurses everywhere ask themselves, what can I do? What can we do? And I have this thing I always say, silos do not serve us. No matter where we are in the world, it is important to lean into, as nurses, our natural professional ability to build bridges. And in nursing, I would say for this particular topic, that would look like engaging across sectors, engaging stakeholders within your community, engaging stakeholders within your institution. What does that look like? For example, and it's a very broad, simple example. In terms of one big problem in sustainable healthcare that most healthcare institutions are grappling with, no matter where you are in the world, is medical waste. It's a huge problem. So what does that look like if the nurse were to speak to institutional leadership about how to minimize this waste? Now we begin to look like, well, what is waste? Look to your unit. What products are being used? Is single-use items a possibility? Can we minimize disposable glove use? Nurses are natural innovators, natural connectors, and we cross. This is what we do, actually, taking the information and transforming it and translating it for practical use every single day. So every nurse from the institution at the bedside within the community can look for those opportunities within your setting.
Exactly. I think you just perfectly gave us what we need. You talked about collaboration with the local leaders. I mean, you talked about starting from where we are. When we look at climate change, it might look as something that is far away from us, but it's close to us. It's close to us. And the problems are just in our midst. And the people to collaborate with are the people who have been affected and those ones who are next to us. And those are the local leaders, the people in the same environment. So it looks like wherever every nurse is, there is a problem. The way you have talked about, there is a problem and she has a solution. And then this session, I believe, is like pricking us a bit on how to think more, how to really see that problem and where is our innovation going to help. You also talked about nurses and midwives being natural innovators. Yes, I mean, we can be on wards and then improvise. For example, us working in limited resource settings, you can improvise and make sure that this mother delivers safely, and yet with the limited resources. And that means even in these huge challenges that we are seeing, we can innovate something. So thank you so much. I think that was amazing, very, very helpful. And it takes us to Kara Cook, the Development Director of Alliance of Nurses for Health Environment, if she has something to add on what you just said.
I completely agree with what Millie and Lucy have all mentioned. I think environmental health, planetary health nursing is a smaller but growing field in nursing, and that's really exciting to see. And so I think when we're thinking about where can nurses kind of position themselves in leading on these issues, it's really, starting with educating yourself and then looking to what has been done before. There's some really great examples of nurses who have started sustainability initiatives within their hospitals or healthcare facilities, or who have led advocacy campaigns. I'll drop a link in the chat. The Alliance of Nurses for Healthy Environments has a sustainability toolkit, which does have case studies around nursing initiatives that have been implemented in healthcare facilities. And I know, Lucy, you have a similar resource. So there's a variety of things that those just getting started can look to and figure out where do they want to have the potential influence, whether that be in their healthcare facility or their community or beyond. And then the last thing I'll just say is really finding a mentor can be really helpful, just to get you started, because it can often feel like you're the only nurse working on these issues where you are at. And so speaking with someone who's been in the field for a little bit longer can be really helpful to building you up and helping you figure out where are the potential places that you can lead. And then I also say find an organization that you can be involved in, because often these organizations are small, volunteer-led, and they're looking for folks to help jumpstart initiatives within the organization and to work with other nurses in the settings in which you are in to help build the planetary health nursing field. And so you can often find a home and get connected with like-minded people that can be really crucial for your journey as you advance your leadership in planetary health.
Thank you. Thank you very much. That was amazing. You just added an appropriate information to what Rosado had just said, and it builds up to what we need. Thank you very much. And now this question comes to you, and also any other panelist can help us to respond to it as we move ahead, especially from this webinar. What is that one practical action that every participant could commit to over the next month to advance nursing and midwifery leadership for sustainable and climate resilient healthy system? What is that one practical action that a nurse could take?
I'm happy. Oh, go for it. Go for it. I'll go and see.
I'll be very quick. The one thing is to begin the conversation. Simply begin to talk to peers, hospital leadership, begin to introduce the nursing perspective in sustainable healthcare. Most of the time, it may be unexpected. And just by beginning to start that conversation, you can plant the seed and grow from there. And that's what
That's it.
Beautiful.
Thank you so much. I mean, starting the conversation, you have seen a problem. You see, it's really bothering you. It's bothering the people next to you. Start a conversation with someone. Maybe I can also share how I started the conversation. When I saw these problems, I went to the small business owners. When I saw plastic bags were moving around everywhere in Kampala, and then I was like, why are they not using paper bags instead of these plastic bags? So I had to introduce this conversation with the people next to me. These are small business owners, but they told me the challenges they face with paper bags, and they told me the things that they bags. Then we started to converse on how to turn from plastic bags to paper bags. And then also when we talk about being innovative, I can imagine how I started to make paper bags myself to pack medicines. And yet there are many plastic bags which are on sale. And paper bags are expensive. I said, let me teach my staff to make paper bags so that we can pack medicines. And we started small. So now starting a conversation is something very, very significant. And I only wish that we shall see nurses and midwives everywhere making climate change a conversation. Could there be someone else who would love to respond to us as regards to that question? What could be that one action to be taken by nurses and midwives right from now?
Brilliant. I'll come in. So, Garth, brilliant. I loved your comments, Milagos. That was absolutely wonderful. It's exactly right. Is begin the conversation, I guess, and then secondary to that, I've already said earlier about education. Educate yourselves. If you're keen and you want to learn more, you've got thirst for knowledge, seek it out and then share it. But something really simple you can do tomorrow is, and I always think it's the basis of evidence-based practices. Start questioning why you're doing things, because as nurses and midwives, we see waste in the system. We see things that, we've always done it this way, or the policy says we've got to do that. But start questioning, is there a better way, a more efficient way? Do you need to use those resources? is there a better way that we can do and support our patients? And by asking those questions, you'll start looking and reviewing your practice and looking at the better way of doing it that will protect the planet and the people that we're serving. So that's probably my advice to you all.
All right. Thank you very much. I think we have very few minutes remaining, and we are heading into question and answer session that is going to be led by Zipporah Iraji. She's a registered nurse and a Challengers Committee Global Lead. Please give in your questions so that they can be answered by our speakers. You're welcome, Zipporah.
Yeah, thank you so much, Harriet. I have learned a lot from this conversation. So far, we have 3 questions from our audience, and I want to ask them all and just pinpoint somebody to answer them so that, because just taking note of the time. There's a question from Wendy asking, and I think I'm going to throw this to either Cara or Milagros. What evidence-based interventions currently link climate change and mental health outcomes in vulnerable populations? I'll give you a moment to think on that as I shoot a question to Obianuju. There's a question on AI, and the question is, AI rapidly advances. How can the global healthcare sector scale these technologies to enhance nursing and midwifery without increasing the environmental footprint? What strategies can ensure that climate-conscious AI implementation doesn't stall critical healthcare innovations in under-resourced regions? And to you, Lucy, as they think about the answers. While individual responsibility and action is really important, what can nurses what can they do to advocate at a political level for systemic change at both national, regional, and global levels? Ensuring that they're holding their countries and other corporations to account. So over to you, Cara and Milagros.
Thank you. And I will just provide a quick resource for a mental health intervention because we do know climate change has significant impacts on mental health. There is a coalition of organizations, which our organization is a member of, called the International Transformational and Resilience Coalition. And they have folks all over the world that are implementing what they call resilience coordinating councils. And it's basically based on the premise that in order to, we don't have enough mental health providers to care for people in those acute traumatic phases of mental health as it relates from extreme weather events. And so we need to be building the resilience up front so that when climate related stressors hit, the community is cohesive and has that connection already ready to go so that they can respond in ways that help uplift mental health as a community. And so it's really community leaders, health professionals leading in those early stages versus relying on the care happening after the event. And it's really based in trauma-informed care, and it does have a lot of research behind it. So I'll pop the link in the chat so folks can check it out because I know we're short on time.
Thank you so much, Cara. And I think Harriet is a good example of just working with communities. Milagros, do you have anything to add?
Yes, very quickly. I dropped in into the chat a World Health Organization policy brief that came out in 2022 that speaks just to this issue. Mental health impacts related to climate change are immense. They are global, and we know that they are impacting across all ages, but in particular, we are seeing this in vulnerable groups such as the elderly, those who are very young, those who have experienced forced migration, dealing with the impacts of climate change. So when you break those down into what that looks like, maybe that looks like drought, maybe that looks like flooding in your area, severe hurricanes. Once you have experienced that, there is this anxiety and this depression. And up till now, modern day psychology has not really had to address the support. And so there is a call for looking at new areas of ways to support people. And so I would urge everyone to look at that briefing and to look into the resources that my colleague Kara shared as well.
Awesome. Thank you so much. And I hope people are, clicking on the links that have been sent in the chat box. Make sure to use them. Obianuju, back to you.
Okay, thank you. I'm also very observant of the time. So firstly, I would say to the number one problem with AI, because AI is expensive, because data is the new oil, is that there is biases that we do not account for when we are gathering all this data. And I would say the number one thing is that we are very involved in data collection as nurses through data, patient history, conversations with our patients. We are in the front line of getting all this information, and we have to ensure that we're getting correct information, because unfortunately, patients do tell us what we want to hear and not what is true at times. So being able to get correct information, correct data from our patients, and being able to provide quality data. And obviously, I'm collecting consent, because if we are sharing this data, it's very important to be upfront about the transparency of how this data is going to be used. Because when there is accurate data that AI are being trained on, then it's reduces the amount of biases and the amount of times that we have to train the data for it to be functional in the workplace, in transcribing, in helping us in early diagnosis of different cases. So I would say the number one thing that we could do is ensure to collect accurate data to reduce the expense of training and retraining data for solving these healthcare issues. Thank you.
Thank you. And evidence is a part of our role, and our jobs as nurses every day. So thank you for bringing that full circle. Over to you, Lucy. How do we advocate in the political and corporate spaces?
Brilliant, but good question, and I'll be very brief because I know we're over time. Use your voice is probably very obvious, and speak up. Write letters to your members of parliament, your government, ask for changes. There's a really wonderful video that a community in the UK pulled together called the People's Emergency Briefing. It's got 9 experts on climate change, from national security, food security to extreme weathers, all put together in a 50-minute kind of documentary. You have to host it. So you could host an event. You could do it anywhere in the world. I've just put the link in the chat for you. And that's a really good way of advancing people's knowledge on what's happening in the world. And then it tells you to kind of get in contact with if you're in the UK member of parliament or whatever it might be within your company, get in contact with your government, whoever represent you locally, and ask for change. But educate yourselves first and share it far and wide. That's a quick one from me.
Yeah, thank you so much for that insight. I don't know, Beneza, if you have any last words to share as we close.
Oh, I would just say that we should all keep to it, do our best, because there have been some massive works that nurses are doing. In the UK, we have the National Glove Campaign that was started by a nurse. So you can do something that could have a national impact. And also in relation to the question on AI, for undersourced places, if we are to have light AI models that run on low-cost devices or offline devices, it could address some of these issues, and even incorporating a bit of assessments or metrics in line with AI and its training could help to reduce some of the problems that will arise with AI, as asked by the participant earlier on. So I would sign off by saying my comment and my quote, which I made a few years ago, that we need to do our best, because if the planet were a being, it would have expressed its emotion by saying enough is enough. Let's try and prevent some of these things. Thank you.
Awesome. Thank you so much. There has been a wealth of knowledge and insight here. I hope every one of us is going to make use of the links and the resources shared. I'm sure the Nursing Now Challenge is also going to be updating the website with all these, so make sure to check it out. Sorry for going over time, but just to let you know, our next session is on the 28th of July, and we'll be looking at climate justice and indigenous knowledge. So make sure you look out for that and register. Thank you all, our panelists, for being here and for taking the time to be with us, and for participants for engaging. And I look forward to seeing you on the 28th of July. Thank you, everyone. Bye. Bye.
Thank you very much. Thank you, everyone. And please, let's end with this note that I alone cannot change the world, but I can cast a stone and ripples will be created. Everyone has something to do. Thank you very much. See you again. As she said, our webpage is going to be updated.